Really sorry I can't be there in person. I got COVID on Sunday after an incredible Burning Man. Just an incredible experience out there. And really want to thank Kevin and Tom and Nathan for all the work they've done here to put on this conference and for the invitation. I want to thank Tom and Cherie for their incredible vision and dream here that's coming true in Oregon. We're the country's first regulated access program for psilocybin, training standards for facilitators and accountability, and that safe, well-structured program that most of the country, most of the population needs in order to access and feel comfortable accessing the healing power that these medicines provide and spiritual transformative potential. Such a vision. And I remember talking to Tom and Cherie, for the first time, and them laying it out and being a little skeptical that it was that the state was ready, but then just getting more and more convinced and that this was the time, this was the election cycle to go for it, and in turn talking to Graham Boyd and getting him convinced, and just teaming up and making magic happen, and all the other rock stars that plugged in to make it happen, Ben and Sam and everybody there. Thank you so much. And really setting the example for the rest of the country. Really excited for the work that the Healing and Advocacy Fund is doing there, especially collecting all the data that's going to enable us to show that psilocybin is a cost-effective intervention for alcoholism, for addiction disorders of all kinds, which is really great. Actually, pairing with 110, which we also supported, and decriminalizes all drugs in favor of a treatment not jail approach to addiction, and so necessary. And what a beautiful 1-2 punch. And all these brothers and sisters and siblings can access psilocybin to help with the struggles they're going through. And as we collect that data, we can get Medicaid to cover as well. So that's hugely important. And access is hugely important. And just want to really shout out the Cherie Eckert Foundation that Tom and Nathan and I are on the board of, and we're raising funds to sponsor both facilitators from marginalized populations, BIPOC populations. We want to make sure that we're training up a cohort of BIPOC facilitators so that people from these populations really feel comfortable accessing this medicine and can be talking to people who resonate to their experience and won't accidentally, potentially further harm. Raising those funds, and that's going to be, training program neutral, and really excited to work with all the different training programs in making these scholarships happen. Also, Patient Access Fund is also going to be part of that. Really excited by the potential for the foundation to also support patients from BIPOC and just other marginalized and indigent populations be able to access this healing. Was talking with Rebecca at Alma. I'm really excited by the fact that they've got their group healing model coming online here in the next year or so. As they train up their cadre of facilitators and get comfortable with group model, offering group therapy, and I know other training programs are as well. That's going to really bring the costs down. And we want to really make sure that this initial cohort of patients getting treated in the first 2 years, especially before Medicaid kicks in, that we're really making sure this is an equitable program. So really excited for all that. Also want to talk about the religious use. Shout out to John Dennis and all his great work. Even if 109 isn't quite the policy fit at the end of the day for whatever reason, it's just so crucial that we bring community healing models and people being able to grow their own medicine and heal together and access in a church environment. And so that policy, we're going to be working hard with our allies at the Plant Medicine Healing Alliance to make this happen in Portland in election cycle in 24. So decriminalize all the medicines in a responsible way, of course excluding peyote and toad. Synthetic 5-MeO is of course what people should be using, not toad, and then of course peyote. Let's leave that alone until the wild gardens are rehabilitated and Native American leadership is given the okay. But yeah, so really excited here to complete the policy picture there. You know, we got 109, 110, PMHA and allies, and working with the Portland Psychedelic Society and just other allies to complete this picture. Yeah, Oregon's leading the way. It's just so exciting, and Colorado is about to go, and we're really building on everything we learned there in Oregon, and it's just awesome to see. And once we crush it in Colorado, a deep purple state, and an off-election year, I think we can get 2/3 majority if things go right. That's just going to unlock a lot of the legislative efforts, such as in California. Unfortunately, we had 519 get torpedoed in a committee maneuver, but we were almost there, and we feel confident that if we can, with just crushing hard in Colorado is going to unlock California and a lot of other states. So yeah, onwards we go. Thank you so much. Have a great conference, have a great party, have a great time, and bam.